So to properly dissect this sciatic nerve, first we're going to peel back all of these muscles here. And then we can kind of expose a little better and kind of focus in. I'm going to zoom in here. What we have here is the tibial nerve root, and then also the common fibular nerve root, which both form to join the sciatic nerve. So we'll kind of look at the length of the sciatic nerve here. You can see it kind of runs down the entire posterior femur here and then branches there. So for the time being, we're going to come back up to the top. What I want to do is actually spin this guy around. If you can, see the tibial nerve and the common fibular nerve from the front. What I want you to notice is those two nerve bundles are formed by the nerve roots that are coming off each of these vertebrae from the top. So all of these upper and lower lumbar nerve roots come down and form those two nerves, which then form the sciatic nerve. So we're going to spin around. We're not actually trying to look at the sacrum. I'm going to zoom back out. And we're going to come down to the posterior knee here. I'm going to zoom back into where the sciatic nerve actually begins to split. So we have sciatic nerve, and here we have tibial nerve, which runs down the center line of the posterior knee there, and then we have the common fibular nerve. So this common fibular nerve is kind of interesting because it kind of wraps around that lateral knee. If you're into MMA or kickboxing or whatever it might be, this is the nerve that a lot of those boxers and kickers will attack because it's kind of exposed on that lateral surface. There's not a lot of muscles there to protect it, and so you can actually kind of paralyze that nerve with enough trauma. But let's not get off topic. Let's come back up here to the sciatic nerve. So as you look at the sciatic nerve, I want you to notice, there's our sciatic nerve. I'm going to pull back up here. So notice that it is formed by all of these lower lumbar segments and then comes into this thick rope-like structure there on the posterior thigh. And so if you have what's called sciatica, you may feel pain on this lateral hip because that sciatic nerve kind of comes out and then down, so you may feel pain there. Or you may feel pain all the way down the posterior thigh, and then you can actually feel it come down the back of the leg and even all the way down to the feet. Now, what I want you to realize also is that it's covered by a lot of muscles here, so it's pretty well protected. Pretty well protected, right? So even if we come up to the lower back there, pretty well protected, so you can't really attack it from the outside. An important concept to try to get my patients to understand, and I want people to understand, is that sciatica, the diagnosis, is actually a symptom of something that could be going on at the lower back or in the hip. A lot of times you hear about piriformis syndrome, muscles that attaches here on the hip and then crosses to the sacrum there. Kind of put these muscles back on, that way you can view that. So you can kind of see there, that's the piriformis. If it's tight, it can kind of cause some pressure on that nerve there. Or anything that might be going on in this lower lumbar spine, whether it's spinal stenosis or a herniated disc or inflamed muscle. Any of these muscles that are laying on top here, if they get a tear and cause inflammation, they can irritate that sciatic nerve. The sciatic nerve itself does not have damage, but rather an indirect effect of other things that might be going on. So any of these joints here in the lumbar spine, we're going to kind of zoom in here. If there's something going on here, the nerve root, where these nerves kind of exit the spinal cord. So if we kind of zoom in right in here. So say we have some form of inflammation in this area, right in there. Well, that nerve runs down, and then we now know that it forms the sciatic nerve, so that can actually cause pain down the back of the leg. So sciatica in itself is just a symptom of another primary diagnosis, inflammation or herniated disc or any of the other topics that we've listed, and is an indirect effect of something else that might be going on, because it's highly unlikely that this sciatic nerve, you can see that it is a thick rope-like, and if you've ever been in a cadaver lab, you know that this thing is thick. I mean, you could literally play tug of war with this thing and it's not going to break. You know, you always think about nerves as narrow and thin and fragile. This one is not, and a lot of the other ones aren't either. It's just this one in particular definitely is not. It's not going to tear. It's not going to rip. It's affected by the things that are going on around it. So just an important concept that I like for people to grasp. Hope you enjoyed the video. If you like this video, hit that subscribe button, and if you feel led to do so, hit that thumbs up button for me. It really helps the channel out a lot, and we'll see you next time with Body Talk.